Before you pour your morning coffee tomorrow, watch this. A 72-year-old man thought his morning routine was protecting his health. Instead, it may have been placing unnecessary stress on his heart for years. When his doctor finally connected the dots, the truth was shocking. And according to heart specialists, millions of adults over 60 may be making the exact same mistake right now. The most surprising part? It doesn't feel dangerous. In fact, most people believe it's healthy. So before you start your day tomorrow, make sure you're not making the same mistake. Because what happened to John could happen to almost anyone. And what his doctor discovered might completely change the way you think about your mornings. John was 72 years old. He wasn't the kind of person people worried about. He wasn't overweight, he didn't smoke, he rarely drank alcohol. He took his medications exactly as prescribed. He went for walks. He tried to eat reasonably healthy meals. Compared to many people his age, John seemed to be doing everything right. His family often joked that he would outlive everyone. Even his doctor usually complimented him on his lifestyle. But there was one thing John never questioned. One habit. One routine. One small decision he made every single morning. And because it felt normal, because it felt harmless, because he had been doing it for decades, he never considered that it might be affecting his heart, not until a routine medical appointment changed everything. One morning, John went in for a routine cardiovascular checkup. Nothing was wrong. At least that's what he thought. He wasn't experiencing severe chest pain. He hadn't suffered a heart attack. He wasn't in an emergency room. But over the previous several months, he had noticed something strange. Occasionally, he felt lightheaded. Sometimes his heart seemed to beat faster than expected. Certain mornings left him feeling unusually tired. Nothing dramatic, nothing alarming, just small changes, easy to ignore, easy to blame on age. So that's exactly what he did. Until his doctor ordered a series of tests, blood pressure monitoring, blood work, heart imaging, and a detailed review of his daily habits. When the results came back, the doctor noticed something unexpected. John's heart wasn't failing. But there were signs that his cardiovascular system was under more strain than expected. Enough strain to start asking questions. Important questions. Questions that eventually led directly to John's morning routine. The doctor looked at John and asked, "What is the very first thing you do after waking up?" John smiled. "Easy. I make coffee." The doctor nodded. "Anything before that?" "No." "Water?" "No." "Breakfast?" "No. Just coffee." The doctor leaned back. And that's when the conversation became interesting, because the problem wasn't necessarily the coffee itself. The problem was what John wasn't doing before the coffee. What happens to your body overnight? Most people never think about what happens while they sleep. For 7 or 8 hours, your body receives no fluids, no water, no hydration, nothing. By morning, many older adults wake up mildly dehydrated. As we age, this becomes even more important. The body's thirst signals become weaker. Many seniors simply don't feel thirsty, even when hydration levels are lower than ideal. At the same time, blood pressure regulation becomes less efficient. Circulation changes. Blood vessels become less flexible. The heart often has to work harder than it did decades earlier. Now imagine adding strong caffeine into that situation before giving your body any water. For some people, the impact may be minimal. For others, especially those with cardiovascular concerns, the effect can be much more noticeable. Why this matters after 60? When you're young, your body can compensate for many things: lack of sleep, poor hydration, irregular routines. The body is remarkably resilient, but after 60, small habits begin to matter more. Tiny daily decisions become powerful. The difference between thriving and struggling often comes down to routine. The difference between stable energy and exhaustion, between healthy circulation and unnecessary strain, between prevention and regret. That's why John's doctor wasn't interested in dramatic lifestyle changes. He focused on small habits, the habits repeated every day, because daily habits create long-term results. The simple change. The doctor's recommendation surprised John. It wasn't complicated, it wasn't expensive, it didn't involve medication. He simply suggested, drink water first, 1 or 2 glasses, then wait a little before consuming coffee. Eat a balanced breakfast. Move your body gently. That was it. No miracle supplement. No special treatment. No complicated program. Just basic physiology. John agreed to try it, and what happened next surprised him. The results. Within a few weeks, John noticed changes. His morning dizziness became less frequent. His energy felt more stable. His heart-racing episodes occurred less often. He felt more alert, more comfortable, more balanced. The difference wasn't dramatic overnight. It happened gradually, the way real health improvements usually happen. Slowly, consistently, quietly. And that's what makes this story so important. The biggest threats to heart health are often silent, but so are many of the solutions. Morning. Mistake number 2, jumping out of bed too fast. Most people do this every day without thinking. The alarm rings, they immediately stand up, then start walking. But here's the problem. Blood pressure changes when you move from lying down to standing. As we age, those adjustments may happen more slowly. That's why some older adults experience dizziness immediately after standing. In some cases, it can even increase fall risk. A much smarter approach? Sit on the edge of the bed for a moment. Move your legs. Take a few breaths. Allow your body to adjust. It takes less than a minute, but it may protect you from a serious injury. Morning mistake number 3. Skipping breakfast. Many seniors skip breakfast because they simply aren't hungry. Others believe they're helping their health. But consistently skipping breakfast can create challenges. Energy fluctuations, blood sugar instability, poor concentration, overeating later in the day. A heart-friendly breakfast doesn't need to be large. It just needs to be smart. Protein, fiber, healthy fats, nutrients. Simple foods often work best. Eggs, oatmeal, Greek yogurt, fresh fruit, whole grains. The goal isn't perfection. The goal is consistency. Morning, mistake number 4. Starting the day with stress. Many people begin each morning by reaching for their phone. News alerts, negative headlines, financial worries, political arguments, social media drama. Within minutes, stress hormones begin rising. Heart rate increases, blood pressure increases, anxiety increases, and the day hasn't even started yet. Imagine beginning differently. A quiet walk, prayer, meditation, deep breathing, gratitude. A peaceful start creates a completely different physiological response. Your heart notices the difference, even if you don't. Morning mistake number 5. Believing, I feel fine. This may be the most dangerous mistake of all, because many heart conditions don't announce themselves. High blood pressure often has no symptoms. Elevated cholesterol usually causes no pain. Early artery disease can remain silent for years. Heart rhythm abnormalities may go unnoticed. Many people assume, I feel okay, so everything must be okay. Unfortunately, that's not always true. John felt fine, yet his tests revealed warning signs. Not because he ignored symptoms, because there weren't many symptoms to notice. This is why routine checkups matter. Prevention works best before a crisis occurs, not after. The lesson. Every senior should hear John's story isn't really about coffee. It's about awareness. It's about understanding that our bodies change. The habits that worked at 40 may not work at 70. The routines that felt harmless decades ago may deserve another look today. Health after 60 isn't determined by one big decision. It's determined by thousands of small decisions, repeated day after day, year after year, glass by glass, meal by meal, morning by morning. Final message. Tomorrow morning, before you reach for your coffee, pause. Ask yourself a simple question. What does my heart need right now? Maybe it's water. Maybe it's movement. Maybe it's a healthier breakfast. Maybe it's less stress. Maybe it's finally scheduling that checkup you've been postponing. Whatever the answer is, remember this. A healthy future is rarely built through dramatic changes. It's built through small choices made consistently. John discovered that at 72, and because he did, he was able to make changes before a serious problem developed. That's the power of awareness. That's the power of prevention. And that's the power of one small decision made tomorrow morning. because sometimes the habit that seems the most harmless is the one worth taking a second look at. If you enjoyed this video, subscribe and let us know in the comments. What's the first thing you do every morning after waking up? This simple question might reveal more about your heart health than you think.